Today's video is how families pay for home care. I've already recorded it. I should have done it over again. I got distracted. I was a little bit rushed at the end, but that's okay. Not everything's perfect. It's done. It's understandable. It makes sense. My suggestions are that if you do not take veterans benefits, Medicaid waiver, obviously don't talk about those things. What you really want to talk about are the programs that you accept as a home care agency, not all of them that are available, because they'll just backfire on you. Just talk about private pay and long-term care insurance if that's all you accept. That's okay. Talk about it. But I know that some of our clients take all kinds of different things. So I did private pay, long-term care insurance, veterans benefits, and what was the other one? Oh, Medicaid waiver. And I also talked about Medicare briefly from the perspective that it really doesn't pay long-term. It may pay for some short-term care, but it's probably not going to pay for in-home long-term care. That's not what it was designed for, and that's not what it's going to pay for. So I did talk about that a little bit in a nice way. So there you go. This is video number 7. Planning for home care can be overwhelming for families, especially when it comes to figuring out how to pay for it. In this video, we'll explore different ways families can cover the costs of home care, including private pay, long-term care insurance, Medicaid waivers, and veterans benefits. Many families start by using private pay. This means covering the costs out of pocket using savings, investments, or other personal resources. While this offers flexibility in choosing options, it can also be expensive and deplete savings quickly. Another option is long-term care insurance. If your loved one has this type of insurance, it can help cover some of the costs of home care, or maybe all. However, it's important to understand the policy's terms as coverage can vary significantly, and not all plans include home care benefits. For those who qualify, Medicaid waivers are a valuable resource. Medicaid is a joint federal and state program that assists with health care costs for those with limited income. While Medicare typically doesn't cover long-term care, Medicaid waivers can provide assistance with home care, but the eligibility requirements and benefits vary by state. If your loved one is a veteran, they may be eligible for veterans benefits that can help with the cost of home care. Programs like Aid and Attendance Benefit provide additional financial support for veterans and their surviving spouses who require home care, but it's important to navigate the application process carefully. Now, you might be wondering, what about Medicare? While Medicare is a valuable resource for health care, it rarely covers long-term care needs. Medicare may provide short-term assistance such as in-home skilled nursing or therapy services, usually after a hospital stay, but it's not designed to cover ongoing home care. Understanding these different payment options is essential for planning for home care. Whether it's private pay insurance, Medicaid veterans benefits, each option has its own benefits and challenges. By exploring all avenues, you can find the best way to support your loved one's needs. Thanks for watching, and call us today at 314-456-7892 if you have any questions. We'd be happy to help you and answer those.